first of all, the certification is something that we have to work on with the provinces. The federal government doesn't have records of vaccinations of Canadians. In our country, we have a division of responsibilities in regards to the Constitution that allows the provinces to be deliverers of healthcare and keeps them in control of the healthcare system. So that is why we are working with the provinces on establishing a formalized certification of vaccine. But you will understand that the priority in the provinces and indeed across the country was rolling out vaccinations and controlling the spread of COVID-19. And that is what we have worked on. Now, as we get closer to reopening, we have a path towards people using their proof of vaccination that they have already received to be able to travel this summer, but we will have a more formalized process in line with what countries around the world are doing in order to keep people safe. And that, in terms of establishing international norms, in terms of making sure they're actually approved and usable in all the countries that Canadians want to travel to, will take a coordinated effort by the world, even if Canada is advancing faster than the rest of the world in terms of vaccination, as you know. And in regards to the government-approved accommodations, I think people need to understand what the principle and why that was brought in. It was brought in to ensure that the arrival test that someone takes is negative before they return home to their family to their 2-week quarantine. That's why we brought in that up to 3-day government-approved accommodation as a way of ensuring that anyone who was traveling had a negative result here in Canada before they're able to go off on their own to quarantine at home. So in many cases, those results have come back quickly and people haven't had to stay all 3 days. But we brought that in as a way of ensuring and reassuring Canadians that people traveling into the country are not a significant source of spread of COVID-19, and it has worked.